Hey there, I'm Dr. Jim Collins. Thanks for stopping by. I've got something really interesting to talk about with you, managing dementia-related behaviors. I would say this is the number one most requested training topics that I provide in senior facilities. Every senior care facility has elderly people who are aging in place. Many will develop dementia, the most common one being Alzheimer's disease. And many of those residents, seniors, are going to have behavioral issues or problems. Here's some statistics. Between 50 to 80% of residents in long-term care have dementia, and over 60% have other psychological disorders, including depression and anxiety. Many of these residents will exhibit various behaviors that are labeled difficult or challenging. I don't like those labels. While effectively dealing with dementia-related behaviors can be a challenge to the caregiver, to the roommate, to the family members, to the resident, him or herself, it's very important to understand what behaviors really are before trying to intervene and do something. Let me ask these questions and think of an answer for yourself, and then I'll tell you where I'm going with this. What are behaviors? What do you think the most common behaviors in senior care are? Okay. If you believe in a person-centered model philosophy like I do, behaviors are means of expressing something inside that the demented mind cannot process, and it's far too difficult to express coherently. Behaviors are attempts to tell us about basic and unmet needs that can no longer be verbally communicated. In other words, behaviors aren't difficult or challenging, they are forms of communication. So I've written an article about this. I go into greater detail. I invite you to check it out and read it. And if you want some CEUs on dementia-related behaviors and many others like this, then follow that link. Read the article, go check out the CEUs. I think you're going to be happy that you really did. Thanks for watching. Try to change the way you see and think and feel about behaviors because dementia and the elderly and behaviors, I think we have such a tainted and tarnished view, and we need a fresher outlook on these things. We're all aging. The elderly population is booming in the United States. They're not going anywhere for a long, long time. So this type of stuff can make us, me and you, become better, more effective, sensitive caregivers. So until next time, I'm Dr. Jim Collins. Be well.